Seminoma, basically this one now we're talking of tumors now, either malignant or benign. So in this case, if you are to look under the microscope of a seminoma, you see sheets of large and differentiated cells separated by delicate fibrous septa, usually with a lymphocytic infiltrate in the septa. So if you look at it, there's a lot of lymphocytes infiltrate. So it's some inflammation, chronic inflammation in that case. And it is the most common tumor of the testis. So most tumors of the testis will be seminomas. And usually the incident that occurs most of the time is between 30 and 45 years. That if you look at it macroscopically, that is grossly, the tumor is well circumscribed, pale, creamy white, and homogeneous with a faint lobular pattern. So if you are to look at it grossly, that's what you will see. The one that is malignant, they tend to spread. So usually it is malignant. This seminoma is usually malignant and tend to spread via lymphatic. So through the lymphatic vessels, initially to the iliac and para-aortic lymph nodes. So it's usually a very forgiving kind of cancer if it is discovered early. Because if you discover it early, all you do is you do orchidectomy. Yeah, you remove that testis. But you don't remove it from uko chini, you try to remove it from the inguinal region so that you're able to clamp the spermatic cord early so that it doesn't spread. And then you clamp it, you cut it, and you remove the testis together with the spermatic cord. And mostly, of course, you will have to send it for histopathology. Yeah, so these are other tumors that can affect the testis: intratubular germ cell neoplasia, teratoma. I think we talked about teratoma last time when we looked at the female. Also, this one can affect there. I remember teratoma is from mostly mature cells, blasts. Yeah, and that is why you can have all sorts of structures because it is involved maybe the 3 germ layers: the endoderm, ectoderm, and mesoderm. So it can produce any of those derivatives of those particular layers. You can have also embryonal carcinoma. Those are from embryonal tissues. Yolk sac tumor, last time we talked about, is those tissues that will form yolk sac in development. So you can also have it in the testis. Choriocarcinoma also, you can still have it in the testis. Last time we discussed it in the female reproductive. And then, of course, you can have mixed germ cell tumors that involve maybe the 3 layers and among others. So I don't want to go into a lot of details in that. And you can see a seminoma there. That is, you can see on the left is a diagram that will show how it will appear. And then that is a gross specimen, a cut specimen. And you can see how it looks like grossly. That is a seminoma of the testis. So usually, of course, when you think of a testis, if you are to examine a testis and you realize there is a mass, most of the time we do an ultrasound. And an ultrasound will show probably there is a mass within the testis. Usually we don't do, for testicular tumors, we don't do biopsy. We don't do, for example, core biopsy, no. Because if you do biopsies, you are likely to spread it further. So usually, once you find there is likelihood of there being a seminoma or a tumor within the testis, you usually do orchidectomy. You remove the entire testis and you send it for histopathology. Because if you cut through the scrotum, it will spread. It's likely to spread it to the scrotal wall. Yeah, and then it will spread much. So you have the histopathology, we have the seminoma cells, we have the lobular pattern, and you can see the infiltrate, the lymphocytic, because of inflammation, that will be part of it. If you are to do also histopathology of a teratoma, you can see, as I said, mostly teratomas, like we talked about last time, it has most of those cells of those derived from all those 3 germ layers in embryology: the ectoderm, mesoderm, and endoderm. So, for example, you have the immature cartilage, so you can even form cartilage. You can form glands. You can form, of course, there will be the stroma. You can form even the skin. You can see stratified squamous lining there. Basically, that is the epithelium that will line the skin. You can have the neural tissue. That is the tissue that will form nervous tissue. So you can have any tissue in a teratoma.